So, Sawadee Krap to our Thai friends, Migraba to our Myanmar friends, Salaban Sian to our Indonesian friends. So, good afternoon, ladies and gentlemen. Thanks to joining us today's online seminar. I'm Nina, the Director of Overseas Medical Mission Center of John Christian Hospital. I'm also today's moderator. First of all, I would like to express our highly appreciation for all of the participants from different countries and sectors. Special thanks to our three speakers. Before we start today's session, I would like to invite Ms. Zhang Yachan. She is the Deputy Executive Director of Service Industry Promotion Center of TAITRA to give the opening remarks. TAITRA is also one of the organizers of the series online seminar. Yatan, Ms. Zhang, please.
Ladies and gentlemen, good afternoon.
Good afternoon.
On behalf of TAITRA, the Taiwan External Trade Development Council, it's my great pleasure to join you in this webinar to look at Taiwan's experience in containing the new coronavirus COVID-19. TAITRA and Changhua Christian Hospital work with different organizations to launch a series of webinars in response to COVID-19 in Taiwan and smart healthcare technology since April 24th. I hope all these events will be beneficial for all of us in the ongoing battle against COVID-19. Because of Taiwan's deadly experience of SARS in year 2003, the Taiwan government reacted extremely quickly to the current coronavirus pandemic by immediately initiating border controls, putting together a national face mask production team, and implementing technology-based epidemic prevention measures. TAITRA also helped to assemble a COVID-19 task force consisting of hospitals, medical equipment, medical supply, and smart healthcare companies. Furthermore, a week ago, TAITRA launched an online Taiwan anti-COVID-19 pavilion, which shares Taiwan's experience and matches supply and demand needs for medical technology and medical devices. The pavilion also enables international visitors to seek the best solutions for themselves. TAITRA has been established for 50 years and has 64 overseas offices around the world. We are committed to actively meeting the demands for international visitors and dealing with the challenges of this pandemic together with the world. Before I finish, I would like to thank you all for your participation today. I sincerely hope this event will be of benefit to everyone here. Thank you.
Thank you, Yatan. Thank you, Ms. Zhang, to give us opening remarks. So next, I would like to invite Jeff from Metal Industry Research and Development Center, and is also one of our organizers, to say a few words. Jeff, please.
Hello. Yeah. Good afternoon, everyone. I'm Jeff from IMADC. This is my honor to be here to attend online business matching for epidemic prevention held by Changhua Christian Hospital. Thanks, Dr. Gao. I would like to express a sincere appreciation on behalf of Industry Development Bureau, Ministry of Economic Affairs, and MRDC, and we should online business matching. Thank you so much. Thank you.
Thank you. Yeah. So today's session will be focused on smart medical products applied on the epidemic prevention. Actually, we invite 6 outstanding companies to share their products. So the first 3 companies they are going to present today, which are iMedtac, Markstein Sichtec, and iMWard, the 3 companies. They will present their product. And the other 3 companies we will be arranged on next Wednesday, June 24th. So today's speakers, each speaker has 10 minutes to present how their product apply on COVID-19 prevention and any potential for the future application on other emergency situations. The Q&A is after all speakers finish their talks. So all speakers, please control your time. Where the first speaker is Benny, and he is the business development manager of iMedtac. So his talk is prevention COVID-19 with smart healthcare solutions in quarantine area. Ben, please.
Hello, everyone.
Yeah.
I'm
please.
Baron from iMedtac, and thanks for participate. And I will introduce our solution to how we use the technology to help the hospital to prevent COVID-19. Okay, this is Baron, and so actually I start my presentation. The first one, actually introduce my company slightly. We are focused on smart hospital at the first beginning, and actually, as guys may know, smart hospital is the with highest standard. So we develop our solution in the high standard hospital, and then we can use these solutions into smart healthcare and even in health promotion. So right now, due to the COVID-19 epidemic, we are trying to use our solution. How do we use the solution and help the hospital, help people to prevent? So there are some new trends we want to share with you, and also, of course, these are some of our new solutions. And right now, I think telemedicine is going to very popular, significant growth, because with right now the epidemic, the COVID-19, people want to avoid cross infection. So right now, maybe some quarantine area, so we can deploy the telemedicine card. You can see there's a card with a medical panel display. That means you can easily wipe and clean with alcohol. And we have some video camera, and we have some gesture connection and recognition function that can make the users, like caregiver or the patient, didn't really touch the panel, so we can reduce the touch. And then right now, since the quarantine area, we need some decentralized medicine control. So we have some medicine cabinet. You can control link to your keys to your system. You can manage the medicine control and deploy, and user can like a sub pharmacy. So user can use your car face recognition to recognize if you have a right to take medicine and take the medicine by yourself. And then we even have some like a medicine gesture recognition functions. So then we have introduced some demo case in Taiwan. This is the demo case in Taiwan National Cheng Kung University. This is a very quick, fast deploy in isolation room. You can imagine like a integration house, and for the quarantine ward. So in this ward, we are deploying some EPD, and because with this treatment, actually we have some new treatment. Patient status is very important, so we just show every patient status on the screen in the ward. So the treatment, the nurse, the caregiver can walk through in and see every status about this patient very, very clearly. So they can reduce some medication error or something like that. And in the door, we still have another sign to remind caregiver walking by or going to insert the door, the information and the thing. You can see this the quarantine where you can there's some doorway to change and to deliver some goods from this door. So not only the EPD, but we also see the telemedicine card we can deploy in this case. So this is some real case we are doing in Taiwan. And so let me introduce the solutions one by one. The first one is the telemedicine card. So you can imagine this card will deploy in that room, that quarantine room. But not only the new quarantine room, but also can in everywhere. So because in some case, I know in some, like in Taiwan, like in China, they have some like a temporary quarantine area. In this area, you didn't have some nurse instrument, you didn't have any like a medical equipment. So with this card, you can fast deploy. And in that card, they will support doctor, nurse to inspect the patient with high resolution and telemedicine. So you can just talk, just feel you like nearby. And actually not only the video chat, we also integrate with some text keys. So you can show other system information like this one, so doctor can introduce, can examination, can show the results. And of course, we will combine some instrument like a vital sign, like a portable surgery or portable examination IoT device on the car. We can connect by Bluetooth, by Wi-Fi. So the patient can use this device, self-examination, and upload the data to the doctors. So that's why the total environment, what we can do with this telemedical card. And in this one, we want to introduce our gesture recognition solutions. Especially, you can see as a video right here. They can recognize two, or I just wave. So they can insert the instruction with my gesture. So in this case, I don't need to really touch any screen. Actually, this solution, this technology, we first deployed in the surgical room. But with this epidemic to prevent COVID-19, we use this technology from surgery room. We just took it out and put into the telemedicine card. So we can let everybody don't need to touch the screen. So you can see there's many gestures we can recognize, and in the surgical room, we can use this gesture to set some hints during all the procedures. And this is the decentralized medicine management. So we can use the two-way of identify function like a car recognition, like face recognition. After that, we can confirm you are a qualified person who can access this medicine. So we can screen the prescription, check with the EMR, and then the right drawer will open. You can only take the right medicine at the right drawer. And of course, all the action will be memorized and all the action will be logged, so we can retrace. And this one is the ePaper. I think it's a very popular solution. Right now, we have we just installed 700 pieces in the National Taiwan University in the new branch. I assume it's the #1 case in the world. So in their new hospital, their bedside, we have this display like this one. We can show some information like patient information, caregiver information, test control. For example, if easy falling, you don't need to take a pill or something like, or some precaution notes. And we even have some action function. You can call the nurse, call the caregivers, clean the room, or call the 999 emergency call. So in this case, you can see there's a really case nearby the door. So we want to introduce a new model. Actually, before is a smart healthcare, but actually smart healthcare with this intelligent service, we can help the nurse, the hospital to optimize their caregiver and their procedure to treat the patient. Therefore, better SOP, better treatment, of course, will help you to reduce the medical error and reduce the chance to get infected or to better recovery, so we can prevent the COVID-19. That's human touch, that's human error. We will provide a better care service. So that's our quick promotion and introduction at this one. Thanks.
Thank you. Yeah, thank you, Ben. So the second speaker is Josh. He is the sales representative of Markstein Sichtec. So his talk is going to be that the trackway application during COVID-19 pandemic. Josh, your turn, please.
Good afternoon, everyone. My name is Josh, and I'm representing the Markstein Sichtec Medical Corporation. And today my topic is the trackway applications during the COVID-19 pandemic. Before we start how to apply this one in the pandemic, I would like to spend a little bit time to introduce Checkway. Checkway is a video assist intubation system, and it can offer safe, quick, and accurate intubations. As we can see in the pictures, the device, this one is a totally portable kit with a handle monitor, and then and also a blade system that covers with meter number 0 for the pediatric, meter 1 for the pediatric also, and also the Macintosh blades 2, 3, 4 for the adults. And the whole system also including 2 stylets, and then also 1 flexible stylet, which is not very clear seen in this picture. The unique point for this product is that the first of all, it has the wireless transmission, wireless real-time video transmission, and then that would allow the doctor to see better. And also, it can be quickly switched between among the blade system, stylet, and flexible stylet, which gives the doctors multiple options when they encounter difficult cases. And also the quick, also the manual stylet, which is quite handy for the doctors, especially the doctor with experience with Checkway, maybe for 5 to 10 cases, they can deal with the normal airway or the difficult airway intubations very quickly. So before we go into the topic, I would like to show you the picture and then explain what is intubation and why we need the intubation and how we do it. So intubation basically is while the patient cannot breathe by themselves, then we would put the ETT tube here inside the through the oral cavity or nasal cavity to restore the airway for the patients. And normally, the normal way to do it is the doctor looking from the outside and trying to have a direct view to guide the ETT tube into the oral cavity, past the epiglottis here, and also the vocal cord here, and then put the tube inside, and then to restore the airway. And then sometimes this can be difficult because the curvature here is so difficult to put that in. So video assist intubation system can be a great tool for the doctors. The picture on the left shows the operation theater settings before the pandemic. So we can see that the doctors basically put on their normal surgical gowns, mask, and also the cap, and doing the intubation. In this picture, we can see that the doctor is quite close to the patients because they try to use the conventional laryngoscope to perform the intubations. And then during the pandemic, the picture on the right, we can see that the doctor need to put the extra protection gears to protect them, that including the protective gowns and also the face shield. And sometimes the operation room become a restricted area. So every time the doctor need to enter the operation theater, they need to put on all the protective gears, and then after they left, they need to take off. So there will be a lot of actions going on, and then keep them very busy. The picture here is a stimulation cases showing that showing that the patient coughing during the intubation. So we can see that the fluorescence died here on the masks and then the cloth. And without the protections, the doctors would be exposed to dangerous situations. So under the pandemic, the intubation, of course, the first priority is to save the patients. But under the pandemic, the other tasks is to protect the doctors. So other than the extra gears that we just mentioned, some of the the rule of thumb is to keep the distance for the doctors to the patients, and also to do the intubation as quick as possible to reduce the chance to contaminations. And also remember that the doctor, when they enter the restricted area, they need to put on extra gears. But what if they come in and they find out they don't have enough tools? What should they do? They need to go out again and put on, take off the gear and then take the tools and come back and put on the gears, protective gears again. And that will take a long time for the doctors, and also put the patient into the danger situations. And and also they need to have multiple tools to assist them to face very various of situations. So Trackway is a great tool for this. Here I would like to show a video about how to use the Trackway slided intubation on mannequins. And here we can see it's a wireless real-time video transmissions. And then the picture can guide the doctor very clearly about where to go and how to go. And the stylet itself will keep the distance for the doctors to the patients. And the visualization will make the epiglottis and the vocal cord here, and also the tracheal rings are visible, and make the intubation become very clear to them. So, in summary, the trachea intubation under the pandemic is the way to protect the doctors, because it can deliver the fast, accurate intubations, and also because the wireless videos can allow the doctor to see better and keep the distance for the doctors to the patients. I think this is my slide. Thank you very much.
Thank you, Josh. So the last speaker is Benjamin, and he's the Associate Director of Iron Force, and he is going to present the modular isolation room. Benjamin, your turn, please.
Hi, everyone. My name is Benjamin, and I'm the Deputy Director of Iron Force. Firstly, I would like to introduce a little bit about Iron Force. We've been around. We are a Taiwan-based company, and we've been around for around 40-ish years in Taiwan, and we specialize in precise metal manufacture, and mainly in auto parts, and also in other retail areas as well. And with the coronavirus, let me share my screen view with you. With the coronavirus situation happened, we thought to ourselves, when so many patients, they go to the same place, the same hospitals, and then there is only a limited amount of quarantine rules, there's going to be a lot of cross infections. And so what we came up with is what we called a modular isolation room. What does it do? First of all, it prevents contaminated air from leaking out, and it decreases the chance of cross-infection. And then it can be easily assembled and actually disassembled on site. And lastly, but not least, it provides some comfort and privacy to the patients. And there is a lot of add-on to this modular isolation room. About the prevent the contaminated air from leaking out is that we implant a very high standard filtration system, ULPA, and also a medical standard airtight door to screen out about 99.999% of the virus while the air actually ventilates. So the air still flows in and flows out, but with the filtration, it blocks all of the 99.999% of the virus outside. And secondly, with the easy installation, is that when issue when the coronavirus happened or any other virus that might happen along the way, is that we can assemble these modular rooms anywhere on site in a very quick manner. And also, because it's modular, the way we design it is that it's modular design, so it can decrease the production time. So unlike the temporary hospitals, for example, the Fire God Mountain hospitals, they take 3 weeks, a month to build them. But unlike these temporary hospitals, and we can build these on site within hours. And by the time that this pandemic is finally over, it can actually be put away. They can be disassembled and put away for storage like this. And for the next time, if anything comes up and you need to use them, you basically bring them out and then assemble them again. And there are two kinds of modular isolation room. One is what we call a single unit. The size of this is very much like a phone booth. And then you can combine two of these units together and you get one large unit. So which one do we use? For the single unit, you can use them at the airports, train stations, shopping centers, and you see when you go to shopping centers, or even if you go to your work office, sometimes they use the infrared thermometer to check your body temperature. And what happens if they actually find out if somebody is having a fever? They can ask them to go away, go to the hospital, or they can ask them to stand there and then ask for a medic to come. And then that person will be just standing there and then spreading the virus at the same time. So what we propose is that if you find out anybody who has a fever, you can ask them to sit in this one single unit, and then for the medic to come and even do to check if he is actually got the coronavirus or not. And then before the result come out, the person can just stay in it. And for the two single units combined together, it will become a size that can fit a single bed. So if there is a lot of confirmed victims, we can just we can assemble them and then lay them out on inside a community center, a gym, any indoor open areas would be a great place to put them. So this is the size of these actual products. So if you can take a look at this, a real person can lie inside of it and then be isolated for 14 days. Up to 14 days, you can use it. And these are some of the information. This is the medical air tight door that we mentioned, and the size of this is that we can put a single bed in it. And the top of the isolation room is all transparent. We use acrylics for the transparency, and you can see the air filtration. The filter is on top of it, so this is where the air comes in, and this is where the air goes out. And then both of this, either in or out, have the ULPA 99.999% filtration system. And here is some inspection report and about the material certification. This is the DOP test that we did. It actually filters minerals up to 0.1 mil to 99.999%. Okay, and this is all manufactured in a clean room, 100% screening. And here's some SGS certifications that we have for the wooden panels, and also this for the flame resistance tests. And then the reason why we're putting this picture here is just for you to feel the size of this thing. It fits one person perfectly, and we can put a single bed in it, and then it fits one person perfectly. Okay, so you can take a look. Everything on the top of it, from the half of it to the top, is all transparent. So when the person is lying inside on the floor, they got these wooden panels that will block their views, give them some sort of privacy. And then, however, when they look up, they will see the transparent acrylic, give them a sense of space. And these are a few of the optional add-ons that can be added to this isolation rooms. Our toilets, and also heater for the shower. And one thing, this is an add-on, so this is an optional buy. If the customer, they do decide to go with this option, they will have two doors. They will have a primary and then a secondary door that will decrease the risk of being infected, or decrease the risk of contaminated air from going in and out. And these are another few add-ons. We can use the UV light sterilization when the person leaves the room, and then the UV light can turn on and then sterilize the room. And also an intercom system. If we are laying out hundreds of isolation rooms, the nurses will be difficult to monitor each and every one of these patients. So these intercom systems will have a help button. And for the patients, if they have emergency, they can just click on it, on the help button, and then ask for help. So basically, this is the end of my presentation. Thank you very much for your time.
Thank you, Benjamin. So before we open our QA, actually we have Dr. Loisa. She's from Philippines. She would like to give the feedback and comments for today's session. Loisa, are you online?
Hi.
Hi.
Yeah.
Yes, please.
Hi. I'm Dr. Loisa Orense, the Medical Director of Mondial Medical Technologies Incorporated. We are a distributor of medical equipments in the Philippines. And I've met some of the distributors here from Taiwan at the BTEC conference in Thailand last September. And Nina, I find these presentations very inspiring, especially for third world countries like us. Like, these are very useful, and you know, I will echo these presentations to our to many people here in our country, so that, you know, they can make use of. We've ordered some laryngoscopes from Josh Chen, the second presenter, and we're starting to test them now here in the Philippines. For all the presentations, we'd like to have a copy, so that you know, it will be easier for me to echo it to our friends here in Manila and the other provinces. We're quite problematic about the COVID-19 here, and currently my personal company is doing monitoring for COVID positive close contacts in one city here in Manila. And the good thing is this can be, what you presented here can readily be applied to what we have here. I will also tell this thing to the Philippine Medical Association leadership, so that in case there's something that, you know, our team can do to help in the COVID-19 with your equipments and your contacts there in Taiwan, so that, you know, it will be easier for us to control COVID-19 in our country. Thank you so much for the very good presentation, and I'm inspired. I'm going to attend the next presentations that you will be telling me to attend to.
Thank you, Luisa. Yeah, I
So
wish
there.
that we can. I can make you.
So I'm leading a project here
Yeah.
in Manila, and
Yeah.
hopefully after the pandemic, we're going to see you here.
Yeah.
And let's bring all those very good products to the Philippines.
Sure. We will plan that. Yeah. Thank you very much. Yes.
Yes.
Yeah. We also have another the reactor Nino. He the sales manager of the international business department of Unison Health Group. Yeah, because as I know, Unison has ambitious to build a platform and network for promoting the medical devices in Taiwan to South Asia countries. So, Nino, could you please like to share this idea and how do you think today's presentation, please?
Yes, thank you, Dr. Nina. Good afternoon, everyone. I'm Nino Yu, sales manager of Unison Healthcare Group in charge of international business. Unison Healthcare Group is from Taiwan, was founded in 1955. We started to sell Philips large medical equipment in 1965 and following by Siemens in 1970. And then become the official Taiwan distributor for GE in years 2015. We are proud to be one of the rare companies who cooperate with GE, Philips, and Siemens, which is what we call GPS in healthcare industry. Rewind back in years 2009, we entered a new era by introducing the first robotic system, Da Vinci, coming up with Mako robotic system, InTouch Health System, and ROSA Robotic Surgery System. Our product and service range is from radiology, cardiology, angiography, nuclear medicine, orthopedics, robotic system. We recently set up the overseas subsidiary in Thailand as the first step in Southeast Asia. Unison Health Group would like to create the platform from inviting excellent Taiwan medical devices vendor. Join us, cooperate with each other for promoting Taiwan medical devices. It's my great pleasure to participate in this seminar. Today, I think those three Taiwan excellent medical device vendor present the best solution for preventing COVID-19. First, iMedtac focus on smart healthcare solution for a long time, achieve outstanding performance, such as telemedicine, decentralized medicine management, no contact control system. Those medical equipment demonstrate the future of medical devices. Second, Checkway. Video assist intubation system could help physicians handle airway intubation procedure more easier. Keep distance between patient and physicians. Protect physician during intubation. Increasing success rate and shorten the time of intubation. Last one is Iron Force Industrial Company, modular isolation room system, easy installation, not a one-time use product, easy disassembly and store in storage, convenient for transportation. I believe those medical devices are the product of Taiwan. Unison Healthcare Group will be the best strategic partner for distributing Taiwan excellent medical devices in the Southeast Asia. Not only preventing COVID-19, but also improving healthcare environment. Taiwan can help. Thank you, everyone.
Thank you, Lino. I hope you can successful.
Yeah,
Okay.
thank you, Dr. Nina.
Yep. So now we are going to open for QA. So if you have any question would like to ask any of our speakers today, you can identify your name, organization, and the question addressed to which speakers. So you can, if you have a question would like to ask, you can turn on your microphone. Anyone? Okay, maybe I can ask iMedtac first. So for most medical professionals or hospitals directors discovered the information technology was so important, particularly in the COVID-19 outbreak. And it will be the future trend to integrate the IT or AI into the hospital system. So however, this cannot be achieved by one step in the short term. So according to your experience, Bennett, what might be the priority solution for the hospital to make it smarter? So what's your comments?
Okay, thank you, Dr. Nina. I think actually, as you mentioned, smart healthcare is really a big map for the future hospital upgrading. So of course, we guys should need to achieve that step by step. Even in Taiwan, we already use this trend for around 20 years. So right now, for my personal comment, I think if other countries want to achieve a smart hospital, of course, we need to focus on two very common sides. Well, one is of course outpatient, and one is inpatient. I assume in outpatient way, I know in some Asian country like Vietnam or some in Thailand, your public hospital is very crowded. Like even in Taiwan, we are doing the same things. So more crowded, more patients stuck in the lobby means more easy to contaminate infection. And that's right now for the COVID-19, but in the past, it caused a lot of patients afraid of go to the hospital because we need to wait a very, very long time. So I assume, of course, the outpatient progress, like curing, like go to the clinic, and how to use the waiting time to perform a better patient experience. For example, in our experience, like a curing system, like our vital sign self-measurement system, like many kiosks in the public area, people can walk through, use their ID card or national insurance card, whatever, just plug in and get everything vital sign data done, and all the data will send to the server, sent to the platform. So the doctor will know everything about your outpatient activity. It's one way to upgrading the outpatient experience and reduce the chance to get infection in right now. And in the inpatient, just like an inpatient area, like we just introduced, the ePaper or the bedside terminal display, because we can display and send the right and latest information for each patient. So therefore, the doctor, the nurse, the caregivers, they can provide the suitable and the right treatment to the patient. So everybody will on the same page. There are no, sorry, I cannot say no, but reduce a lot of medical error in this case. So that's my suggestion for the step-by-step to achieve a smart hospital. Thank you.
Thank you. But do you think that will be spend a lot of budget?
Yeah, of course, we will spend more budget if then compared to you didn't do everything. But actually, in our experience, you spend money, of course, you get some benefits. For example, the patient certification, no medical error, especially no medical error. I think human life and human safety cannot estimate by money. And of course, you can estimate by money with the patient certification, because more patients willing go to your hospital means more budget. I think Dr. Nina in Zhanghua Christian Hospital will know that will feel that very clearly, because in Zhanghua Christian Hospital, they're doing a lot of like patient certification ways. So it means a lot of patients go to Zhanghua University, Zhanghua Christian Hospital, and people going much, and of course income go much. Thank you.
Thank you. Thank you. And the other question I would like to ask Josh. So that the image of traceway become not clear or lack because of the distance between monitor and trackway. So how far would be the maximum distance?
Yes, thank you, Dr. Nina.
Yeah.
The maximum distance is about 10 meters. We set up this, 10 meters. We set up this because the technology is used a radio frequency. It's like a walkie-talkie. So, so we know that sometimes the walkie-talkie can interfere with each other. So we set the distance about 10 meters, and then it's the reference number for the operation theaters, the size of the operation theaters, and also the distance between the two rooms. So we have went to many hospitals in Taiwan, and then in Asia, and also in Europe. And then we try the trackway in different operation rooms. So if we are using two systems in the operation room, one next to each other, then and then if the door is kept closed, and we don't find the interference between the devices.
Thank you, Josh.
Thank you.
I found someone leave the message. Would like to ask Benjamin and Joey Molina.
Okay, this is a question for Ben Lee. Thank you for your presentation. And I am wondering about the ultraviolet disinfection process that you show, because I would like to know the wavelength of the UV illumination source, and also if you have some kind of test or evidence that this UV illumination source is effectively inactivating the coronavirus SARS-CoV-2.
Okay. Thank you very much, Joel, for your question.
Yeah, please.
For the UV light, a lot of these UV lights, they are applied on site by our customers directly. Up until now, the UV light sterilization, this add-on option, have not been purchased just yet. Most of our, well, actually, all of our customers decided to purchase these UV lights directly domestically, and then implements these UV lights on site. So this is currently not an option that our customers choose at the moment.
Okay, so let's see if do you recommend another disinfection process for the panels on the MIR, this isolation room?
Didn't catch you there, Joe.
Yeah, instead of using ultraviolet illumination source for disinfection process, do you recommend another procedure for disinfection of these MIR systems?
Thank you. One thing that our customers, one of our customers said was very effective was the ozone. What happens is that they place these these single units outside of their hospital, and they have people coming in for infection checkup, and for every patient that comes in, and then when that patient is finished the checkup and leaves, they will use this ozone machine and then put it in there for about 30 seconds or so. And then for the I'm sorry, the 30 seconds is what is my guess. I cannot tell you. I don't know exactly how many seconds they put in there, but according to our customer, that the time was very short, and this is what they use. So one customer comes in, they use the ozone machine to clean it, and then the next patient can come in.
All right, thank you, Benjamin.
So Benjamin, continue the question. So do you think what kind of the most challenges when we would like to set up this module?
Okay, thank you, Dr. Nina. In the very beginning, the coronavirus pandemic came to us, well, all of us, very quickly, and the need for these modular isolation room also came quickly as well. most of our customers are not in Taiwan, but from outside of Taiwan, from Europe, from the States and other countries. And one of the challenges was actually for them to assemble the product. We understand that the first edition of our instruction manual and also the first edition for the isolation room was not the best product yet, because the assembly can take some time. However, we have fixed that problem and also made the installation manual quite easily now. So accordingly, these modules, the single units, they can be assembled within 2 hours and then be ready to use. So that was the main challenge that our customers had, was is there any faster way to assemble this? And then problems, that was the main challenge.
So actually, the module didn't be applied in Taiwan, right?
No, not in Taiwan. No.
Yeah, maybe that's because the hospital, they have enough of the negative pressure room. I think so, right?
Exactly, Dr. Nina.
Okay, yeah, I see. Okay, Louisa, you have question? Yeah, please.
I'd like to ask the third presenter, Ben.
Ben, yes.
On the modular isolation rooms, you already have a distributor of these modular products in the Philippines. I'm quite connected here on the. I'm quite connected here with realty companies. So I'm thinking, like, it can be helpful for our country to have those.
Thank you, Louisa. Thank you so much for your generous offer. To answer your question, we currently don't have a distributor in Philippines, and the reason why is very simple. We just don't know anyone. we don't.
Now you know me.
Let's connect, Nina. Yes. That's why we have this conference.
Yeah, definitely. Thank you, Louisa. Thank you so much. We've been doing business for more than 40 years, and all of our customers are in the States or in Europe, and so we just simply don't have any connections in the Philippines or Vietnam or Thai countries.
Yeah.
So that really,
yes.
Yeah.
So many people here are thinking of doing isolation rooms because our cases in the Philippines for coronavirus is still increasing up to now.
Yeah.
It's still on the uptrend. That's why, I know that, this will be useful at some point in the future, like probably in several weeks to a few months, because, we're not yet on the plateau, like we're still increasing in number. And, I'll be suggesting this to some friends. That's why I want to take hold of the PowerPoint presentations that you have so that, I can link up the people here to our company and some friends here in the Philippines.
Okay, thank you so much.
Yeah, both on the medical devices side and on the isolation rooms. I'm also into artificial intelligence SMS broadcasts. And currently, I have a project in a city here in the Philippines. And we're testing it in one of the, second area here in the Philippines that has the most number of COVID positive patients. We're doing contact tracing now with the medical association here supporting me. So probably just in case they will be needing that, I will be asking Nina to connect me to you.
Okay, good.
Thank you, Louisa.
Okay, so Benjamin, do you have a distributor in Malaysia?
No, unfortunately,
okay.
No.
We have the investment director, from the Taiwan office.
Okay.
Yeah. Sekela, you are online. Would you like to say a few words?
Hi, Nina.
Yes, my good friend.
Hi. Okay, thank you for inviting me for this session. This is like a very insightful session, to know about Taiwan's technology in this pandemic and COVID-19 situation, especially the speaker number 3. It was like very interesting, you know, some sort like portable quarantine unit. So I think that is quite interesting to us in Malaysia, because we experience mass COVID-19 cases. So maybe I will bring this technology to Malaysia to propose to our country. Okay, Nina, thank you.
Good. Yes. Any question from our participants? Yeah, because time is almost up. Yeah. If no question, yeah. Anyway, if you have any question you cannot ask right now, you can leave message for us. Then we can have to contact to our 3 speakers, 3 companies today. We will ask them to reply your question or your needs. And today's PowerPoint we already open to download. So later on we will show the QR code for you. Then you can download the PPT for today's speakers. So our next session, we still have another 3 of our companies. They were going to present on next Wednesday. We will send the information for all of our counterparts, all our friends. And thank you very much to join us today, and hope to see you next time. Bye-bye.